So we're looking at pineal gland next. So the image that I have here, I actually started out with a printer. I think it became a scanner, I think. So maybe you can call it a printer or a scanner. Basically, it has a body, and then there's a light, or maybe a small place in the middle where you can actually see what's happening inside. It's kind of a light, let's say, and then you have the place where you actually feed the sheet. So a printer, maybe, so that's kind of the printer that we're going for the pineal gland. Okay, so in this chapter I've used a lot of office equipments. All right, so that's why you're seeing the printer, you see the table and the chair and stuff like that. Okay, so let's go into the pineal gland. Pineal gland again is another important gland. It's loads of functions. It's covered in one paragraph, but when you look at the functions, there's loads of functions it's given in your NCERT textbook. So by the way, every single point that I'm mentioning here is all from NCERT. There's nothing out of the syllabus. If this is out of the syllabus, I will let you know. Okay, this has all been asked in the previous year questions. So let's see. So the paper feeding part of this printer resembles the letter C, stands for circadian rhythm. So the pineal gland, one of the main functions of pineal gland is to maintain the circadian rhythm because it secretes the outline of the central thing resembles the letter M. So the top half of that resembles is M for melatonin. So melatonin is a very important chemical. It is secreted in response to the light in the environment. So when it becomes dark, the melatonin production increases. You get more sleep here. Okay. So this is a very important organ that controls the circadian rhythm. Circadian rhythm is, as you probably know, it is the rhythm of, the natural rhythm of the body, which varies from day and night. And that's maintained by the pineal gland. Okay. And the bottom part of the slit, right, resembles another letter M, which stands for menstrual cycle. So pineal gland also forms, also has a role in the regulation of menstrual cycle in females. Okay. The next is, the port itself is, you can't really see clearly what's inside. So we're gonna use this. From this off. So we're gonna use these lines to denote that, and it stands for the letter T. It stands for temperature regulation. Okay, and then you see the body of the printer here on the two legs on which it stands. This is one P, this is D. Okay, so there's a P and a D here. The P stands for, oh, what did it do? Okay, so probably have to read out again. Okay, so there you go. Okay, P stands for pigmentation, right? D stands for defenses. So what are the functions of the pineal gland? The circadian rhythm on the top, the melatonin, temperature, menstrual cycle, pigmentation, and defenses. These are the functions of the pineal gland. Sorry. Okay, is that clear? All right. Okay, so that's very straightforward. So you need to remember the functions. The questions may ask is, which of the following the pineal gland does not control which of the following. They'll give you temperature, menstrual cycle, pigmentation, and they'll give you, body weight. So body weight obviously is not the right answer, but stuff like menstrual cycle and defenses is not very. You won't associate that commonly with pineal gland. Pineal gland, when you think about pineal gland, you always think about melatonin, the circadian rhythm, and and the temperature maybe, but you don't think of menstrual cycle as such. You can also think of pigmentation as well, but not with menstrual cycle. Okay, all right. Next, we're coming to the thyroid gland. All right, so we have this image from the NCERT textbook. Thyroid gland, all right, is in the front of the neck here. So it has two lobes, the right and left lobes. So it's right and left lobes, and it's connected by something called a narrow tissue of thyroid gland called isthmus. This is situated directly under the trachea here. Okay, and on the back side of the trachea, so this is the front side or the ventral side, and this is the posterior side or the dorsal side. You can actually see these parathyroid glands. These are kind of embedded within the thyroid in the back of the thyroid. Okay, right. So this is how thyroid is actually present in humans. So let's see what are the functions of thyroid. We're going to see, with regards to thyroid, we're going to see two things. One is we're going to look at the functions of the thyroid gland, of thyroxine hormone secreted by the thyroid gland. And we're also going to look at the diseases that's caused by either increased production or low production of thyroid hormone. Okay, so let's see the functions. So this is the flower pot standing on a table. right? So it's a nice flower pot, right? And there's a bit of water, and there's a bit of maybe, bit of insects or maybe mosquitoes inside the water. Maybe it's old flower pot. The table doesn't work very well. This flower pot has mosquitoes inside. I don't know. This must be a very old office. Anyway, you have the table here. This is a slightly different table. And then the floor is there. There's all these stones on the floor, and the table legs. It should be proper, but it's all broken here. You have a broken table, and the top is not great. You have all these, very rusty looking office furniture here. Okay, so that's what we're going for the thyroid gland. Okay, so the function of thyroid gland. So these are the rows here. So this stands for the letter B, which stands for basal metabolic rate. This is one of the most important functions of the thyroid gland. It sets the tone for the metabolism of the whole body. So if the thyroid is low, you're going to have something called hypothyroidism, where if you feel very lethargic, your body weight is going to start increasing, your body temperature is going to drop down. You're going to all the manifestation of low metabolic rate. So thyroxine, one of the important functions of thyroxine is maintaining the basal metabolic rate. Okay, and then the top lip of this flower vase resembles the letter M, which stands for metabolism of fats, proteins, and carbohydrates. So it actually contributes to metabolism of all three macronutrients. Okay, and then you look at the top of the water level. It's kind of wavy, so it stands for the letter W, which stands for water and electrolyte metabolism. Okay, and the mosquitoes talking about is the letter R. Okay, and it it also helps in the increase in RBC production. Thyroxine also increases RBC production. Okay, remember that. And the bottom base of the flower vase resembles the letter C, stands for thyrocalcitonin, which actually reduces calcium levels in the body. Okay, all right, are we clear with the functions? Basal metabolic rate, metabolism of fats, proteins, and carbs, water and electrolyte metabolism, increase in RBC production, thyrocalcitonin, okay, which reduces thyroid calcium levels. All right, we're going to look at the diseases caused by thyroid hormone production, either increase or decrease. The top of the table resembles the letter C, stands for cretinism, which is which is caused by the lack of thyroid hormone during pregnancy. So the kid will get cretinism. It will have mental retardation, poor IQ. So it's a very important disease that you need to know. Okay, hypothyroid during pregnancy causes cretinism. Okay, so we already saw, we have gigantism, dwarfism, acromegaly, and then now we're seeing cretinism. Okay, and then you have the two H's, the two legs. This is one H, this is another H. Okay, so this H stands for hypothyroidism, and the other H stands for hyperthyroidism. Hypothyroidism, decrease in thyroid hormone secretion. Hypothyroidism, increase in thyroid hormone secretion. Okay, and the floor is resembles the letter E, which stands for exophthalmic goiter or Graves' disease. G here stands for goiter. So goiter is just means enlargement of the thyroid. So, but it doesn't mean that the thyroxine hormone is produced in excess. So you can have an enlarged thyroid gland without any increase in production of thyroxine hormone as well. Okay, that is possible as well. So goiter is a term used to denote any enlargement of thyroid glands. So enlargement of thyroid glands is called goiter. Exophthalmic goiter is a specific type of autoimmune disease. It's also called Graves' disease, where your exophthalmos is the eyes popping out. So you will you'll see that these patients' eyes are really popping out. The upper sclera is, normally the sclera above the cornea is not visible. When that sclera is visible, it's called exophthalmos. In this particular type of goiter, where the thyroid gland is enlarged, it also produces antibodies, where there's retroorbital accumulation of fat, which pushes the eyeballs out. So this specific type of disease is called exophthalmic goiter, or also called Graves' disease. It's an autoimmune disease, right? So that's mainly for thyroid. The flower pot on the table, that covers the whole thyroid gland. So let's go through it very briefly. Basal metabolic rate. Okay, so as I tell you, it's better if you draw it, but even if you just close your eyes and follow it through, it'll be fine. Metabolism. So first thing is basal metabolic rate in terms of functions. The metabolism of fats, proteins, and carbohydrates. You have water and electrolyte metabolism. Increased RBC production. Thyrocalcitonin, which reduces calcium levels. The diseases, the thing that you need to remember is cretinism, is important, has been asked before. Hypothyroid during pregnancy, hyper and hypothyroidism. Okay, then you have goiter, and then you also have exophthalmic goiter or Graves' disease. Okay, happy? All right. We saw how the thyroid gland looks like in the image. Now we're going to look at parathyroid. As we saw earlier, there are 4 parathyroids. Okay, 1, 2, 3, 4, 2 on each side. Now for parathyroids, you don't need any GAMT because it's very straightforward. 4 parathyroid glands. The parathyroid, the important thing you need to remember is the parathyroid increases the calcium levels in the blood. Okay, we saw another hormone that reduces the calcium levels in the blood, that is this, which is thyrocalcitonin. The parathyroid increases the calcium levels. How does it increase the calcium levels? So it increases the calcium absorption from the gut. Okay, it increases calcium absorption from the kidney. So basically it actually absorbs calcium from the gut, from the kidneys, and also which other part of the body has a lot of calcium? Bones. So it increases calcium absorption from the bones. Okay, so it increases osteoclastic activity. So the osteo is bone, and then if you have osteoblast, or the cells that help in production of bone, osteoclast, or the cell that helps in destruction of the bone. So parathyroid increases osteoclastic activity, which means that these cells are going to destroy the bone and release calcium into the blood, so thereby increasing the blood calcium level. So this blood calcium levels should be very tightly controlled, and that's brought about by the balance between parathyroid and the calcitonin both together. Okay, right? So that's very straightforward. Parathyroid increases calcium levels, increases absorption in the gut, increases absorption in the kidney, increases calcium absorption in the bone. That's all you need to know. Okay, thymus is the other gland, which is usually present just below the sternum, behind the sternum. It secretes a hormone called thymosin. Thymosin is essential for both T cells and B cells. In terms of T cells, it helps in differentiation of T cells into memory T cells and different natural killer cells and a lot of different cells. In the B cells, it increases antibody production by B cells. So thymosin actually is central for all these white blood cell activity. So that's all you need to know from thymosin. So it is reduced in elderly. So in NCRT is given as one of the reasons why elderly is more susceptible to infection. Okay, so in terms of parathyroid and thymus, you don't need to have separate GAMT for these. They're very straightforward. Parathyroid, one thing you remember is increased calcium levels, and it does this by increasing absorption from gut, absorption from kidneys, absorption from bones, by increasing osteoclastic activity from the bones. Thymus, it's increased thymosin. Thymosin, straightforward. It helps T cells and B cells. T cells helps in differentiation, B cells increase in antibody production. It's reduced in elderly. That's all you need to know. Okay. All right, so we still have adrenal medulla, adrenal cortex, pancreas, testis, ovaries, and others, and mechanism of action. Okay, so we'll cover this in the next class. Okay.